After years of scientific advancement, humanity has reached the point of wearable technology. Some smart devices, like Apple Watch, are able to measure physiological values like heart rate. Now, scientists are trying to take it one step further by making wearable devices that are able to detect the content of your sweat. The contents of one's sweat can reveal the concentration of a multitude of molecules in the body, including potassium, sodium, and chloride items, glucose, as well as lactate. Knowing these values can help doctors diagnose diseases in their patients. For example, high levels of chloride items are an indicator for cystic fibrosis. Additionally, pharmaceutical companies can monitor how bodily ion concentrations change when testing new drugs on test subjects. This concentration monitoring can also be used for diabetics who need to measure their glucose on a daily basis.
Measuring sweat content can be an accurate method of determining physiological quantities due to sweat's connection to blood plasma. Sweat glands produce water with high concentrations of sodium and chloride, as well as small amounts of other molecules like lactate. Sweat glands acquire these fluids and ions from the interstitial spaces between cells. The interstitial fluid between cells derives from blood provided by blood vessels, which supplies the materials necessary for sweat production. Any changes of the blood's content will be present in sweat due to this linkage. For example, high-intensity exercise causes the body to conduct anaerobic metabolism using pyruvate in the muscles, which produces ATP and lactate as a byproduct. If done long enough, an increased blood lactate will occur. This will cause a higher amount of lactate to be present in the sweat as well due to a higher concentration gradient of lactate in the interstitial fluid of cells.
Sweat sensors work by being in direct contact with the skin in order to collect sweat. The sweat sensors are able to adhere to the body like a common Band-Aid due to the sweat sensor's modulus of elasticity being close to that of the skin's. The elasticity similarity allows the sensor to extend and contract with the skin, which prevents shear and tensile forces from compromising the adhesive on the sensor. Sweat sensors are composed of three major components: an external primary coil, a sensor with porous substrates, and an impedance analyzer. The primary coil generates a time-varying electromagnetic field that induces a current within the sensor, which causes a resonance frequency that can be recorded. The sensor's resistance will change depending on the contents of the sweat that is introduced to the sensor. The pores of the substrates in the sensor will fill with the contents of the sweat, which causes colorimetric changes in the substrate and alters the radio frequency characteristics of the sensor, namely its potential difference. The addition of the contents from the sweat causes a change in potential difference in the resonance frequency equation. A change in resonance frequency changes capacitance of the sensor circuit, which causes a change in resonance frequency. This new resonance frequency is then noted by the impedance analyzer. The analyzer calculates impedance by taking into account the changes of resonance frequency, the resistance of the sensor coil, resistance of the primary coil, series inductance, and the integrator sensor coil coupling factor.
Most technologies for measuring physiological quantities of the body share the same low analyzing time of sweat sensors. For example, current lactate sensors are able to determine blood lactate levels within 13 seconds of acquiring a sample. Additionally, these lactate sensors use a similar method to determine lactate levels of the user. Contents of the blood are passed through a semi-permeable membrane, which causes an oxidation or reoxidation reaction to occur. These reactions cause a change in current produced in the working and reference electrodes, which is directly proportional to the contents of the blood. However, unlike sweat sensors, most measuring technologies require invasive procedures, i.e. blood to be drawn. A major deterrent to drawing blood is that constant lactate level monitoring is unsafe. Having a patient prick themselves multiple times in a short duration will cause excessive bleeding and pain. Additionally, sweat sensors are able to measure a multitude of physiological quantities with just one sample.
Sweat sensors look to be a promising development in the world of concentration monitoring. Sweat sensors are able to determine the concentration of several physiological quantities with just one non-invasive sample. Some limitations of sweat sensors is that some physical principles can interfere with their reading. The temperature of the sensor can cause the sensor to contract or expand, which will cause a change in resistance of the sensor. Additionally, swelling of the sensor due to sweat collection could further interfere with the readings. However, the proper use of materials during manufacturing can prevent this. Even with proper materials being selected, sweat sensors aren't giving a one-to-one reading of bodily content. Sweat glands reabsorb sodium during perspiration, which will give a lesser reading of bodily salt content. It's important to consider as well that sweat is a derivative of blood plasma, which means the sweat sensor is giving a watered-down reading of plasma content. As technology advances, sweat sensors are becoming an important tool for gathering physiological markers for athletes such as lactate, and they hold a lot of promise for medical diagnoses.